Greetings, everyone. I'm Dr. Supratik Bhattacharyya. I'm consultant endocrinologist based at Kolkata, and I'm going to share with you real-world experience with the Empa-Lina fixed dose combination. So I must say at the onset that I have an extensive experience of using this molecule, and quite a significant number of my patients are on this combination because of the ease of use, and at the same time, because of the Empa-Lina fixed dose combination being a very small pill, which is very easy to take, and without any specific timing to the meal, it's very, very convenient for the patient, and that's why it increases the compliance as well. Besides, we know that individually empagliflozin as well as linagliptin does have very robust data in terms of cardiovascular as well as renal safety. So with this background, I want to share some of the real-world clinical experiences that were generated by using this fixed dose combination in clinical practice. Second study that I want to share is clinical effectiveness of fixed dose combination of Empa-Lina in patients with type 2 diabetes unwilling to continue basal insulin therapy. And this was again a real world experience in Indian setting. And these were individuals who were relatively close to their target HbA1c and were on low doses of basal insulin. However, they refused to continue with their insulin therapy, and thus a combination of Empa-Lina were considered for these individuals. The patients were 53.38 years mean. Body weight at baseline was about 72.8 kilos mean, and the BMI was 28.2 mean. Now, if we wanted to share that at the end of the 12-week study period, what we saw was the HbA1c was maintained at 7.1, which we saw at the baseline when the basal insulin was discontinued. Similarly, the fasting glucose, which was at 129 mg at baseline, was 125 mg at the end of the study. The prandials was 154 at baseline, and after introduction of Empa-Lina and stopping of basal insulin, we saw that the prandials was also maintained at 143. So numerically, the prandials were lower than at baseline. The body weight also reduced from 72.8 kilos to about 70.9 kilos. And most of the patients achieved the HbA1c without any episodes of significant hypoglycemia. So this is again a very, very interesting find, and probably this is a treatment option that remains to be explored in those individuals who are using very low doses of basal insulin and very close to the target. And if you need a robust oral hypoglycemic agent combination in the form of FDC, Empa-Lina can be considered in this particular group of patients, especially those who are overweight or obese and at risk of hypoglycemia.